Hi everyone, welcome to On Point. In this video we are going to discuss about autoimmune disease. So without any delay, let's start the video. Autoimmune disease. Autoimmune disease is any disorder in which loss of function or destruction of normal tissue arises from humoral or cellular immune responses of the individual to his own tissue constituents, may be systemic, as systemic lupus erythematosus, or organ-specific, as thyroiditis, Goodpasture syndrome, related to kidney, insulin-dependent diabetes mellitus, islets of Langerhans, Graves' disease, thyroid abnormality, pernicious anemia, intrinsic factor, anti-nuclear antibodies, ANA. Test, RA rheumatoid arthritis. SLE, systemic lupus erythematosus. It is the one type of autoimmune disease. Sign and symptoms: fever, weakness, arthritis, skin rashes, butterfly rash over cheek of young girl. LE cell, lupus erythematosus cell. Introduction: LE cell is usually neutrophil which has ingested the altered nucleus of another cell, neutrophil. It is most commonly seen in connective tissue disorder, that occurs more frequently in women of childbearing age. The degenerative tissue releases a protein into bloodstream that acts as antigen. The protein produces autoantibody against 2 antigen. The pathological condition is called autoimmune disease. These antibodies are known as LE factor, which are anti-nuclear, and IgG in nature. LE factor, antibody, releases an enzyme deoxyribonuclease, which depolymerizes the DNA of the nucleus of neutrophil. As a result, spherical homogeneous mass is formed, is called LE body. It is engulfed by other neutrophil, and forms LE cell. LE cell consists of neutrophil, containing a large spherical homogeneous body, which stains pale purple, with Romanowski's stain. The nucleus of cell is usually displaced to one side and may appear to be wrapped. Principle: serum containing anti-nuclear antibody, or LE factor, or anti-nuclear factor, has affinity to nuclear material. When necessary trauma is given to neutrophil, nuclear material releases, which depolymerized by LE factor, and forms homogeneous round mass, LE body. It attracts neutrophil, and is engulfed by it, and forms LE cell. Methods: 1. Using patient blood. 2. Using patient serum and normal neutrophil. Using patient blood, it is routinely used method. Procedure: 1. Collect 2 to 3 ml of blood in a vial, containing glass beads, 5 to 7 in numbers. 2. Shake the vial gently for 20 to 30 minutes, or rotate at 33 rpm, for 30 minutes at room temperature, for defibrillation technique, and for given necessary trauma to neutrophil. 3. Incubate the defibrinated blood, at 37 degrees Celsius for 15 to 30 minutes. 4. Fill Wintrobe's tube, and centrifuge 1000 to 1500 rpm for 10 minutes. 5. Discard the supernatant, and make the smear, thin smear, from buffy coat. 6. Keep the smear at RT for air drying, and stain with Romanowski's stain. 7. Examine under oil immersion field. Result: LE cell positive, seen; LE cell negative, not seen. Precautions: 1. Shake the blood gently, to give necessary trauma to WBCs. 2. Before filling Wintrobe's tube, incubate at 37 degrees Celsius for at least 30 minutes, to make LE cell. 3. Smear should be prepared from buffy coat. 4. Excess of anticoagulant should be avoided, because it inhibits the LE factor. Clinical significance: 1. Positive LE cells suggest SLE, or DLE, disseminated lupus erythematosus, where 75 to 85% cases show LE cell positive. 2. A positive reaction has also been reported, in hepatitis, and certain drug reaction. 3. Also in 3 to 6% of patients with rheumatoid arthritis, particularly when disease is severe, and hyperactive. That's all for now. For more updates please do like, share, and subscribe. See you in next video. Thank you.